All right. Good afternoon. Thank you for joining us. I'm Nate Zeller with Secured Retirement. We're very excited about our new partnership with Chapter that provides us the ability to now help out our clients when it comes to Medicare, answer some of their questions, and make sure that they have optimal coverage. We're especially thrilled to have Ari Parker, the head of Medicare advisory at Chapter, join us today to present this webinar to answer a lot of the questions that many of you might have. And so I think you're going to get a lot out of this. And really, from that, I'm going to turn it over to Ari and let him take it from here and tell us all about Medicare and what he has to offer and the whole entire team at Chapter. So Ari, it's all you.
Thanks so much for the introduction, Nathan. Can everyone hear me okay? Thumbs up? All right, great. Very excited to be here to present It's Not That Complicated. We're excited about our partnership with Secured Retirement. And if you have any questions, please don't hesitate to reach out to me. I'm our head Medicare advisor and co-founder. And just a little bit about me and how I got into this. That's a picture of the book I just wrote. It's called It's Not That Complicated because I really believe that. But my backstory is I'm a lawyer by training. And what I noticed is my dad really struggled to sign up for Medicare. My dad had a lot of issues. He only took Medicare Part A. He didn't start Medicare Part B. And he was a trained physician. When he had a hernia problem come up in early 2021, because he hadn't started Medicare Part B, and I'll get into what that means, he wasn't able to access affordable medical care. So he waited until he just chose to wait. He chose to punt the decision, and it cost him his life. And so that's when I realized the importance of really making clear how to get health insurance as part of your retirement. And that's my backstory. Of course, we'd already started by Chapter by then. I was hopeful he would be one of our first clients. But having failed to persuade my dad to make an informed decision, I decided to help spread the word. And so that's how I got started. With that, I want to introduce you to today's agenda, which is Medicare's key parts. We'll go over original Medicare and prescription drug plans and all that fun stuff. Then the 3 bite-sized decisions your clients will make as they go through their Medicare journey. And finally, how your clients can take action because the annual enrollment period is right around the corner. In fact, it starts Saturday. If you have any questions, please drop them in the chat. I don't expect to speak for more than 20 minutes. This isn't a very long presentation, so please ask questions along the way. I'll also add, if you want to check out the book, then you can click here to learn more about me and about It's Not That Complicated. All right, so original Medicare, 2 parts to original Medicare. But I just want to break down health insurance, your client's health insurance, as a stool, a 3-legged stool. And your clients need all 3 parts to have peace of mind and to have the best health coverage possible. The 3 parts are hospital, outpatient, and drug coverage. Hospital, outpatient, and drug coverage. So when I say original Medicare, I'm referring to the first 2 legs of the stool, which is hospital insurance, that's Part A, and medical insurance, that's Part B. And Part B is what my dad failed to start. He only had Part A. So Part A is inpatient hospital coverage. It means that you have a wristband. It means your client has a wristband, and it's typically fully prepaid as long as your client has paid federal payroll taxes for 10 years plus. Then there's Part B. Part B is outpatient. This is medical coverage, or some people like to say it's everything besides hospital. And it covers visits to the doctor, visits to specialists, lab work, x-rays, MRIs, CT scans, even preventative services is covered under Part B. Now there's a charge, it's going down in 2023. So even though Social Security is expected to increase the cost of living adjustment on Thursday, Medicare Part B premiums have already been announced for 2023, and they're going down. They're going down by a few bucks to $164.90. Now, if your client has an IRMA, I'll cover that in a moment. But if your client has an IRMA, IRMAs are going down too a little bit, even though the IRMA brackets have been raised. And we answer questions like that every single day here at Chapter. It's something me and my team are super familiar with if your client has any questions about an IRMA or a Form 44 appeal. So with that, what does Medicare not cover? Well, there are 2 biggies. The first is Medicare only covers 80% of your client's medical expenses. The other 20% they owe out of pocket, and sky is the limit on that 20%. So my mom, for example, just had a knee replacement. A knee replacement in the Chicagoland area costs about $40,000, and it's very similar in Minnesota and Wisconsin, and it's a little higher in Florida, actually. So $40,000 procedure. Medicare, her Medicare covered $32,000, and then she had additional coverage to cover the $8,000. Now, this doesn't include all the pre, post, and physical therapy visits. So that just goes to show you how these costs add up. And original Medicare only covers 80% of medical expenses. So clients need help with the 20%, and that's where Chapter comes in. The other thing is Medicare does not cover long-term care. Long-term care is defined by the activities of daily living, like eating, dressing, bathing oneself, or 24/7 custodial care would be another example of long-term care. Medicare doesn't cover it. There have been proposals to cover it, but so far they haven't made it out of committee yet. So here's a picture of your client's red, white, and blue Medicare card. You're probably familiar with this, but what you might not know is that there's now a Medicare beneficiary identifier. It's an 11-character string of uppercase letters and numbers. If your client took Medicare by way of turning 65, then these dates, Part A and Part B, will match. If they waited past the age of 65, then their Part B date will be different than their Part A date. That's totally normal. Any questions on this? No? All right, that brings us to the 3 decision steps. Step 1, signing up for original Medicare, the first 2 legs of the stool. Step 2, how will your client cover the 20% Medicare doesn't cover? And then finally, taking action, choosing a specific plan, which we're uniquely positioned to do right now with the annual enrollment period kicking off on Saturday. Step 1, signing up for original Medicare. When can your client sign up for Medicare by way of turning 65? Well, as you probably know, it's a 7-month initial enrollment period that begins 3 months before your client's 65th birthday and extends 3 months after. So as an example, if Nathan's birthday is December 23rd, he's turning 65 December 23rd, then the earliest he could sign up for Medicare would be September 1st. Now, if your client needs to sign up for Medicare by way of turning 65, they don't want to wait until the month of their 65th birthday, because then their Medicare won't start until the month after. What if your client works for a small employer? That means 19 or fewer employees. They should sign up for Medicare. Medicare is supposed to be the client's primary insurer. Their employer coverage would be secondary if they choose to remain on it. And I'll cover this in a moment by talking about a special enrollment period. A special enrollment period is for someone who's past the age of 65 and still covered under work provided coverage with a large group employer, which means 20 or more employees, 20 or more employees. So if your client works for a large employer, 20 or more employees, then they get a special enrollment period to sign up for Medicare Part B. Now, a special exception here, they should not take Medicare at all if they're contributing to a health savings account. This is a nuanced rule. So if you do have a client past the age of 65 who's still working and contributing to a health savings account, then definitely reach out to me and our team so that I can help guide you through how to navigate the rule. Any questions on the initial enrollment period or the special enrollment period? Let's see the chat. Yes, John, Medicare Part B premiums will be reduced by a few bucks for next year. They will be reduced to $164.90, which is a $5.20 decrease from 2022. All right, adding your income into the equation. Let's talk about IRMA. IRMA means income-related monthly adjustment amount. This applies if your client earns more than $97,000 and files their taxes solo, or more than $194,000 and files jointly. This applies to their modified adjusted gross income. And if your client's income has significantly changed as a result of starting Medicare, a work reduction, a work stoppage, there are actually 8 valid reasons to appeal an income-related monthly adjustment amount. And our team helps clients file these appeals every day. So if you'd like to learn more about how your client can file a Form 44 IRMA appeal, then simply reach out at the securedretirement@askchapter.com email address. We'd love to help. With that, Step two of our journey is how will your client cover the 20% that original Medicare doesn't cover? So what people don't appreciate is that original Medicare only covers 80%. The other 20% is owed out of pocket. Just like the example of my mom and her knee replacement, she would have owed $8,000 out of pocket for her knee, plus all the pre, post-op, and physical therapy visits thereafter. So when clients realize that they only have 80% coverage, that's typically a great time for us to connect on how to get coverage for the other 20%. What's more is that original Medicare only covers two legs of the stool. It doesn't cover prescriptions, and it also doesn't cover dental, vision, or hearing. With that, there are two options. Marcy, the webinar is about 15 more minutes, but I'm open to questions too, and we do have an hour scheduled. With that, there are two ways to achieve comprehensive coverage. The first is to keep original Medicare and to add Medigap. Medigap sits on top of original Medicare, and it preserves your client's choice of doctor. So that your client can go to Mayo Clinic, for example, or Cleveland Clinic, or if they want to go to MD Anderson, which is one of the nation's leading cancer research institutes, there's no problem with traveling to Houston and using their Medigap plan. The only thing they would need to add in addition to Medigap would be a standalone prescription drug plan so that they have all three legs of the stool covered. The second option is heavily advertised on television. You see William Shatner, Jimmy Walker, Joe Namath talking about these. It's called Medicare Advantage. It's also called all-in-one plans or Medicare Part C. This is a replacement for original Medicare. It substitutes a private insurance company's network of doctors, so it's managed care. Now, what people like about these plans is that they're low cost. They're typically lower cost than Medigap, for example, and they come with additional benefits like prescriptions, dental, vision, and hearing bundled in. What people like less are the restrictions on the choice of doctor that they can see. So if your client wants to go to Mayo Clinic or Cleveland Clinic, for example, then they really ought to be on a Medigap plan, not a Medicare Advantage plan. So if your client values choice of doctor, then Medigap is the way to go. And let me unpack this a little further. In the state of Minnesota, it's called Extended Basic. So these plans are standardized under federal law. The Extended Basic plan is synonymous with what the state of Florida classifies as a Plan G. G as in George. So if you've heard of Plan G, in Minnesota, it's just known as an Extended Basic plan. In the state of Wisconsin, there are riders to select in order to make it a Plan G. So little nuance here in Minnesota and Wisconsin, but do know that when clients are referring to Plan G, that's what it's called. Plan G equals Extended Basic in the state of Minnesota. Now, what's great about the Extended Basic plan, there's no network restrictions. You can see any doctor nationwide who accepts Medicare. There's no referral required to see specialists or to get a second opinion. There's no additional bills or copays. It covers excess charges, for example. It works nationwide, so if your client wants to go get a second opinion in Houston or Los Angeles, there's no issue with it. And it includes 80% international coverage abroad. This story got picked up by the New York Times. We had a client who was traveling in France and suffered a heart condition. They were hospitalized for several days outside Paris. They racked up $30,000 in medical bills. And because they had a Medigap plan with the 80% international coverage, their Medigap plan actually picked up $24,000. They were delighted. An attendee emailed in, my client has a pre-existing condition. Can they be denied for a Medicare supplement plan? The answer is yes in Minnesota. In Minnesota, your client can be denied if they miss their 6-month open enrollment period. That window is only 3 months in the state of Wisconsin. So it's 6 months in Minnesota, and in Florida, it's 3 months in the state of Wisconsin. So it's really important to discuss additional coverage with clients when they sign up for Medicare. So this is exactly when we go ahead and talk to this is exactly the time to be introducing them to Chapter. Cliff asks, is it still $182,000 for 2022? Cliff, you're referring to IRMA. Yes, it's $182,000. The cutoff for whether your client owes a Part B and a Part D IRMA is $182,000 for 2022. It's going up to $194,000 for 2023. Roy asks, what do I need to take if I have TRICARE? TRICARE, thank you for your service to our country, first of all, Roy. And TRICARE for life is as good as it gets. That is a Medigap plan paid for by Uncle Sam, so you don't want to touch that. That brings us to our third leg of the stool, which is Part D coverage. What is it? It's coverage for prescriptions. D is in drugs. The way to get it is through a standalone prescription drug plan if your client goes Medigap, or through a Medicare Advantage all-in-one plan if they prefer that bundled plan. The reason to get it is even if your client doesn't take any prescriptions, there's a lifetime penalty associated with not having a Medicare Part D plan. So it's crucial in order to avoid lifetime penalties to sign up for Part D. Even if your client doesn't take any drugs, it's still highly, highly recommended to sign up for Part D. Those penalties can really add up fast. They actually start 63 days after your client should have had coverage at least as good as Medicare Part D. So in order to avoid the penalties associated with Part B or Part D, this is a natural time to introduce them to Chapter, and we'll help make sure that your clients aren't subject to any late enrollment penalties. Cal asks, if I'm retired but my spouse is still contributing to an HSA, will that go against me? No, Cal, that wouldn't go against you because it's okay for your wife to contribute to an HSA so long as that HSA is in your wife's name. It's fine for you to have started Medicare. And in fact, if you have, you can still use any contributions you previously made to an HSA for any qualified medical expenses. That brings us to our third decision step, which is taking action. And now is the time to take action. We're speaking to clients every single day to help prepare them for the Medicare annual enrollment period, which starts Saturday. What's different about Chapter is that we have a database of, there are hundreds of health insurance companies offering thousands of plans. And we've compiled a database, 7 billion rows of data that compares each of these plans inside and out. And I'm going to give you a taste of that in just a moment. And when speaking to clients, we typically discuss the 3 Ps. I write about this in the book, the 3 Ps. And that is providers. Who are your doctors? What doctors do you want to see in the upcoming year? Have your health needs changed? Have you developed a chronic condition, for example, and you're going to want to see different specialists? We also help clients with prescriptions. That's the second P. What medications do you take? Are they brand name, generic? What pharmacy do you go to? And then finally, priorities. Your client probably doesn't have, even if they like their neighbor, they probably don't see the same doctor or take the same medications as their neighbor. And they probably don't have the same travel plans as their neighbor. So we want to go through your client's priorities with them rather than hearing your client said their neighbor, for example, was on a Humana plan and the Humana plan, but that might not work for your client because your client probably has different lifestyle preferences than their neighbor. So that's exactly what we would talk about in a 15-minute one-on-one appointment. And it's free of charge. There's no charge for your client to work with us. This is something that your client should do every year. We're proactive in our outreach. In fact, for any existing member, we've already scheduled appointments with them to review their coverage for 2023 so we can get going as soon as the new plan information, as soon as the annual enrollment period kicks off on Saturday. What people don't appreciate is that every single year, these plans change. What changes are the premium and costs, the benefits, the physician networks, and the copays. So the costs change every year, so it's important to review this decision every year. So even if you have a client who's already on Medicare, it would be very natural for us to do a review for that with them, just to confirm that they're on the best fitting coverage for their needs based on the 3 Ps. So with that, I'm open for questions. Please email securedretirements@askchapter.com if you'd like to connect with us. If you want to learn more about me, the book, or about Chapter, visit askchapter.org/Ari. It makes a great gift for your clients as they approach 65. Steve asks, hi, Steve. My wife still qualifies for a Plan F supplement due to past coverage, yes. What is the difference between Plan F and Plan G? One difference between Plan F and Plan G, and that is Plan F provides first dollar coverage for the Part B annual deductible, which is $226. Now, you might ask, why would I pay more in premiums for Part F if I'm only getting a $226 benefit? And that's the only difference between them is the $226 Part B annual deductible for 2023. Otherwise, they are identical in every single respect. Any questions?
I was going to say we'll give it another minute or two for questions, but Ari would really truly, I think this has been very informational. So greatly appreciate you taking your time to hop on here. And like I said earlier, we're here at Secured Retirement. We're thrilled about the partnership. So it looks like you have another question in the queue. So I'll let you get to that.
Yes. Kurt, how does Medicare work when you are traveling or working international? Well, Kurt, for the first 60 days, you're outside the United States. You would be covered if you have a Medigap plan, a Medigap plan G. G is in George. An F would cover you as well, G or F, and N would too. So what to know here is that these letter types, these Medigap plan letter types, are standardized under federal law. And if this would be a good one to reach out to our team about, Kurt, just to make sure that your coverage is if you are planning to travel internationally, that you have some international coverage. Travel insurance would still be recommended too, of course, because if you need to be repatriated back to the US, if something happens, that's going to add up quickly. And the cap on these Medigap plans is $50,000 in medical expenses. So the client in Paris was okay because their plan covered 24 of the $30,000 hospitalization costs, but they have a $50,000 lifetime max under their Medigap plan. So it gets technical. Marcy, Plan F and Plan G are identical in every respect except for the Part B annual deductible. Plan F covers the Part B annual deductible, which is $226 for 2023. Plan G does not. So the only difference is the $226 annual deductible for 2023. Galen asks, the donut hole is a part of Medicare. So Galen's question is about the donut hole. First, the Inflation Reduction Act, which was passed by Congress a few weeks ago, is actually going to limit consumers' out-of-pocket costs to $2,000 starting in 2025. So unfortunately, the good news is that relief is coming. The bad news is it's 2 years away. So for this year and next year, we help our clients save $1,100 per year just by reviewing their prescriptions, what pharmacy they go to, what medications they're on. It varies plan by plan. Galen's plan here, she's on a plan that pushed her into the donut hole. So I would just like to review your prescriptions, Galen. I'd like to set you up with one of our senior advisors in your state to see if there's a better fitting plan for 2023 to help you avoid that.
We'll give another minute or two here. I just want to emphasize, though, that there's a lot of information. Obviously, Medicare is very complex, so already has the email address here on the screen to use, or if any of you just want to contact us here at Secured Retirement, we can certainly put you in touch with Chapter, and they're a great team of advisors, so don't hesitate to reach out. Looks like another question just came in. A couple more.
Yeah, John, the way that Medigap works is it sits on top of original Medicare, and it allows your client to see any doctor nationwide who accepts Medicare. That at its core, it preserves your client's choice of doctor. So that's the important difference between Medigap and Medicare Advantage. If your client values choice of doctor, then Medigap is the way to go as long as they can afford the premiums. They also need a standalone prescription drug plan in addition to their Medigap. Kurt, by American Rescue Plan, are you referring to the Inflation Reduction Act? Jeff asks, if I'm turning 65 next year, can I just wait another year and stay on my small business plan so my younger wife has coverage? Jeff, the answer is you can stay on your small business coverage, but it's supposed to pay secondary to Medicare. So you still need to start Medicare. You still need to pay Medicare Part B premiums. Now, what defines whether you're on small group coverage? It means 19 or fewer employees. And Kurt, I'll have to read up on the American Rescue Plan. Off the top of my head, I'm not sure whether there's a connection to Medicare or not. John, the Inflation Reduction Act is going to have a massive effect on Medicare Part D. D is in drugs. The biggest change is that it's going to impose an out-of-pocket cap of $2,000 on beneficiaries' drug costs starting in 2025. So it's 2 years away, but it's a once-in-a-generation change and a much-needed fix for Medicare Part D. And this is for the reason Galen mentioned with the donut hole. That's all being fixed starting in 2025. But for this year and next year, there is still a coverage gap that is a donut hole. And so that's why it's so important to help your clients review their prescription drug coverage. We're the only advisory I'm aware of that has a database where we can do this medication by medication, pharmacy by pharmacy, and go through how your client would pass through the different phases to make sure that they're on the most comprehensive drug plan at the lowest price possible.
I see another question came in on the Q&A. It says, if I'm turning 65 in December and still working, do I need to sign up even though I'm on my employer's plan?
As long as your employer has 20 or more employees, then you can remain on their plan and you don't need to sign up for Medicare. With that said, many work provided plans have, I know our plan here at Chapter has a deductible of that's very high. It's $2,500. Compare that to Medicare's deductible, which is $226 for next year. And so there might be savings. It depends on how strong your work provided coverage is and how much you like it. We do that type of apples to apples comparison with clients all the time. So even if you think you have a really strong work provided plan, it might still be good to learn about your options. Where coming off work provided coverage tends to be great value is for a spouse, because many employers don't contribute significantly to spousal premiums. So there, the $164.90 Medicare Part D premium is a lot lower than what a spouse might be paying for their work provided premium. Other questions, Nathan?
I don't see any other ones coming in, and I've been checking some of our internal chat here, so I think we're good. We're been going for a half an hour, a lot of great information. So
yeah,
I think from here we can, thank everybody for hopping on. Ari, thank you especially for joining us today. This is a real treat, like I've said, a lot of great information. We are going to have a replay available for people that have missed this or anybody that's on that wants to watch it again, have some of their questions answered. And again,
yeah, let me just put up here. There you go. I hope that worked. Did that work? If you or your client want to book a free Medicare consultation with a senior advisor on our team, you can just punch that link I put up.
Yeah, so that's a great way just to get straight into the calendar and book a time to talk to somebody. And if you need help with that, certainly don't hesitate to reach out. And here at Secured Retirement, we can help you get that set up as well, or point you to how to book that yourself, if so inclined.
Daniel has an important question about health savings account plan. HSA plans are amazing. They're triple tax advantaged, but they don't work with Medicare. You cannot continue making fresh contributions to an HSA and start Medicare, full stop. You can use whatever contributions you've made, but you can't make fresh contributions. So if you have any questions about how HSAs and Medicare, when to stop contributing to an HSA, definitely click that link. It's something me and my team help people with every day in order to avoid the federal excise penalty here. Marcy has a question about Chapter. Is it okay to answer this, Nathan?
It is, and I would just, maybe give a broad overview of Chapter and what you do. I think you did at the onset a little bit, but maybe again, just a synopsis.
Yeah, Chapter is an independent Medicare advisory. We're nationwide, and what we do, including, of course, Minnesota, as you can see, Minnesota, Wisconsin, and Florida. And what we do is we search across every single option available to your client. We allow your client to shop every single option, because there are hundreds of health insurance companies offering thousands of plans, 24,000 in fact. And people don't often appreciate this. They think that it's standardized because original Medicare is standardized, but the plans vary county by county across the United States, depending where your client is located. Now, you're probably wondering, how do we get paid? We get paid commission by the 50 plus insurance companies that we're appointed with, but it does not affect our advisor's recommendation at all, because we're searching across all plans, and our advisors are not compensated based on whether your client chooses a plan that we're appointed with or not. What matters to our advisors is whether they make the best fitting recommendation. Oh, thank you, Lynn. Thanks so much for coming.
Yeah, I can tell you by the questions here, this is great, very interactive, obviously spurred a lot of conversation. So I think this is very well received by those that did attend. So much appreciated.
Yep, I know what that means. That's my cue.
Now we'd love to have you stay all day and chat, but I'm sure there's other things you need to do. So thank you again for hopping on. Thank you all for joining us today. And yeah, if there's any questions, certainly let us know.
All right. So, thank you so much, Nathan.
Yeah,
thank you, Secured Retirement.
Thank you all. Take care. Have a great day.